Hi, today I will answer all your queries about BPH or prostatic hyperplasia. There are a lot of myths about it. I will try to answer them. The first one is BPH is a form of prostate cancer. Not true. BPH is a benign condition. It's totally non-cancerous condition. All men will eventually develop BPH. Although it is true that with age, men tend to develop benign prostatic hyperplasia or BPH, but it is not necessary that all men will develop it. Some men can have prostatic enlargement, but it may not have any symptoms. The severity of BPH symptom directly correlates with the size of the prostate. In fact, it is not true. The prostatic hyperplasia can grow into the urinary system or outside the urinary system. So if it blocks the urinary system, then only you will develop symptoms. In fact, most patients may not develop symptoms until the hyperplasia is significant. BPH is a rare condition. Not true. BPH is quite common among all men, around 50% who are above the age of 50 and 90% men who are above the age of 80 years develop BPH issues. BPH directly causes erectile dysfunction. In some cases, yes, with prostatic hyperplasia, there can be erectile problems because prostate being a sexual organ, it forms liquid, proteinaceous liquid for the nutrition of the sperms. It can develop in advanced cases of BPH, but in early cases, it need not cause erectile issues. If you have BPH, you will eventually need surgery. No, that is not true. In early cases, in fact, you can correct it by lifestyle changes. If the problem is more, then you may take medications. There are non-surgical, minimally invasive methods available for the treatment of BPH. Era of open surgeries are over. There are no open surgeries done these days for BPH. Lifestyle changes has no impact on BPH symptoms. In early stage, the lifestyle changes is the first step to take, like regular exercise, maintaining healthy body weight, maintaining proper diet. This will reduce your symptoms and you may not even need medicine to treat prostate issue. If your PSA is high, it is BPH. In fact, high PSA can be because of prostatic infection or sometimes prostatic cancer. Benign gland can sometimes have high PSA if the gland size is very large. BPH is progressive condition and always gets worse. Not true. Many patients have stable condition over the life which does not progress with time. So it is not necessary that with time your condition will become worse. There is nothing you can do about BPH. As I told you, in early stage, you can go for lifestyle changes, regular exercise, proper diet, proper sleep, staying sexually active, avoiding consumption of tobacco, alcohol. These things will help reduce prostatic symptoms and also reduce prostatic growth. If you have already developed symptoms of BPH, you can take medical therapy, which will help you significantly in reducing your symptoms. Surgery is the only treatment for the BPH. Again, not true. Era of open surgery are over. The minimally invasive methods are available where there is no cut or no stitches put and prostate can be safely removed by endoscopic methods. Newer methods like intraurethral slings, stents, and the methods like water vapor vaporization of the prostate rhizome, these are methods which are newly developed and can reduce your symptoms drastically. So if you have any prostatic issue or you face any urinary symptoms,